Namaste. Once again, we come back to the second year program. It's called as Ayurveda uh, Clinical Therapist and Nutritionist. Here, basically, what we are doing is the next level after the first year. First year, we studied about the basics of Ayurveda, the basics, introductions, and those kind of stuff with anatomy, physiology, all those things. But when it comes to the second year, it's more serious we are becoming now. In the second year, we start with Roga Nidana, that is pathology in Ayurveda. We talk about the different doshas and dushyas, how the altered physiology. In the second year, completely we speak about the altered physiology, that is diseased manifestations, disorders, disease manifestations, those kind of stuffs we are going to talk in the second year. So Vyadi Vijnana, knowledge of diseases, and Nidana Panchakas. It's very, very important about the diagnostic elements of the knowledge of that, and Pariksha Vijnanam, examination methods. We have Ashtaveda Parikshas, Nadi, Mala, Mutram, Jihva, Shabda, Sparsha, Druk, Akritim. Charaka says, and Sushruta also says. So in that, we're going to deal about the Nadi Pariksha, which I'm going to do specially trained in that. So Nadi Pariksha we are doing for 1 month course. Then other things like Jihva Pariksha and eye examination, Netra Pariksha, and all the stuff for taste and everything, all those stuff we are going to, all the Ashtabeda Parikshas we are going to deal in the second year. Very, very important area of understanding this. And once we finish these things, the methods of understanding the diagnostic methods and the disease pattern also we will be covering simultaneously. We talk about Vata, Pitta, Kapha diseases. We know how many diseases in Vata, Pitta, and Kapha. All these things we are going to separately, each doshas and its imbalances will be taken care by all our professors in this. There are many modules are there, which we can send it to you when you are applying for second year course. And in the pulse reading, we are going to see the 5 levels of the pulse, which is very, very important. And I'm not sure anybody is teaching outside the India. So we are starting from the immediate level of the pulse, level 1, level 2, level 3, level 4, level 5, all the 5 levels up to the Prakriti. From Prakriti of the Nadi Pariksha to the down level of the Prakriti constitution of a person, the physiological level, pathological level, and the constitution of the person, all will be dealt along with the dhatu, finding of dhatus, finding of sabdoshas. All these things will be educated, we will teach the students, we'll make the students, we'll give the homework for them to learn on in the during the entire 1 month course we are teaching in Nadi Pariksha. It's the most important, according personally, Nadi Pariksha is the most important, one of the most important diagnostic tool available in Ayurveda. Of course, the other areas of examination, physical examination, all those things stuff are necessary, but the unique USP of Ayurveda is Nadi Pariksha. And apart from that, we go to the Dravya Guna. It's one of the most important subjects. Introduction of Ayurvedic herbs like Ekamola Dravyas like Amlaki, Arjuna, Shatavari, Amla, all the stuff we will be covering. About 250 herbs we must be discussing in this second year. And those kind of stuffs, all the concerned specialists will be teaching those subjects like Draviguna specialist. We have some professors are there, so they will be working on these areas. And after that, we are going to deal about the Panchaveda Kashaya Kalpanas, Pashija Kalpana, how to prepare the churna, how to prepare the swarasa, how to prepare the kalka. So different methods of herbal mixtures by a practitioner can do. Those kind of stuff also we are going to work in this second year. So we have divided the different hours of the class hours and assignments, homework, and all these things we have divided. We have a separate hours has been divided according to that. And then the second year we're going to have another dietetics part 2. We have done nutrition in the first year. We also continue the nutrition in the second year also. So we here basically we are working on this a special nutrition for the women, for the young and old. So geriatric nutrition, those kind of stuffs we will be teaching in the second year also. And apart from that, we've tried to conclude the second year. We are going to teach, we're going to demonstrate, we're going to make the students to practice also in Ayurvedic therapies like Netra Basti, Griva Basti, Janu Basti, Uttara Basti, Kati Basti, Uttara Basti, all these things, not Uttara Basti, uh, Urah Basti, and Shirodhara. The Abhyanga first year we taught, and these are the things, external therapies, external therapies is nothing related to with the internal therapies. External therapies, because internal therapies comes in the panchakarma, that we will do it in the fourth year. We don't teach that even in third year. We don't teach, we teach them only in the fourth year, because it's panchakarma is advanced techniques that has to be learned after the completion of your basics of Ayurveda and anatomy, physiology, pathology, Dravyaguna. Everything should be learned. Then only we suggest our students to learn Panchakarma at the end. That's how we study in Indian Ayurvedic colleges. So these are the stuff we are doing in the second year. So we'll be starting from September 11th, 2026. I request all the any institutions, those who have finished their first year in different institutions could join with us, and we will be. If you provide the documentation of proof that you studied first year anywhere in Europe or in India or in UK, so we welcome them to join us in our educational program. And we are, as you know, that we are accredited by the ATAB, Ayurveda Training Accreditation Board, and Rashtriya Ayurveda, under Rashtriya Ayurveda Vidyapit, Ministry of Ayush, Government of India, and we are associated with Dr. Sarvepalli Radhakrishna University, Jodhpur, India, Rajasthan. Thank you very much. Have a nice day.